Hey guys, it's Laura. Let's talk about one of the fears that I often hear in our clinic, and that's with women and their concern over, will hormones cause breast cancer? Where this thought came from was the Women's Health Initiative that was conducted in the late 90s and early 2000s. This trial used women that were greater than 10 years outside of menopause. The average age was 63. They used synthetic forms of hormone therapy like estrogen, conjugated equine estrogen, and progesterone, not the bioidentical forms we use today. And they looked at the risk in a different way than we now calculate risk. And so some of these risks were inflated, and one of those was around breast cancer. So now that these trials have been looked at a little bit further, they've gone back and refuted some of these claims and even found that in the estrogen-only arm, there was a decreased risk of breast cancer. And so that brings us up today. We're using bioidentical forms of hormone therapy, estradiol and progesterone. We do not minimize the risk of breast cancer. It is a very complex issue, and it centers around more than just hormone use. We have to look at lifestyle, comorbidities, environmental factors, genetics play a big role as well. And we want to talk to you about that. We want to talk to you about your fears, your potential risk, and then choosing the correct form of hormone therapy. So in the most recent data, and much research still needs to occur around this issue, but in the most recent data, we are now seeing a decreased risk in breast cancer with the use of estradiol. And we're finding that progesterone is friendly to breast tissue. It's more protective of breast tissue. So we are finding more current research. And whether you see us or you see another provider, you need to partner with someone who has the most recent data. It is important to understand the form that they're referring to, whether that be synthetic or bioidentical. It's also important to look at the current research and see, is there any new data submerging around genetics and hormone therapy, and really quantifying your personal risk, as it is different for every person. If you have any questions, feel free to reach out to us at info@optimizedhealthnow.com or go to our website, optimizedhealthnow.com.